Hi everyone, I'm going to give a demonstration of the clinician dashboard for mPRO. This is what the care team would see, and all of these data are provided by the patient via the mPRO mobile application. So this is our palliative and hospice care experience. And what we see here, Tiny Tim, which we just completed, Tiny Tim's How Are You Doing survey today, does does have an overwhelming score. And you can see as I float over it, he has some responses there. You see the pain is overwhelming, slightly short of breath, not much constipation, slight nausea, vomiting, but overwhelming depression, anxiety. And as we look at this landing page here, you can see this notification bell in the upper right-hand corner. And when you click on that, you see that Tiny Tim would like a call as soon as possible because he's worried about this pain, mostly in his legs. But he also has this notification that says Tiny Tim has reported high levels of pain, depression, and anxiety. So not only does that land on the dashboard, but it also goes out, could go via email, could go via text, could go via EMR in-basket message. So the care team knows as soon as this data kind of hits the system. But let's look at how Mr. Tiny Tim has been doing over the last little bit. So you can see here on August 8th, he's got these big red bubbles for depression, anxiety. And if you look over time, it doesn't look like he's had much of a trend. So this looks like kind of new information. He's had some pain a couple of days ago, but it wasn't related. We're not really sure what it was related to. You can also look at Tiny Tim's medication tracker. So you see that he did not have his pain meds available, which is an interesting thing to think about. Now, if we just search for Tiny Tim and see how he's done over time, you can see he may have ignored a couple of his notifications, but overall, it looks like he's been taking his meds. And I'm just going to zoom out so we can see a slightly longer list here. Yes, overall, it looks like he has been taking, or he didn't have it about a month ago, but it looks like he's had it. So based on this information, we now know what's going on with Tiny Tim. We know that he's reported some concern. We know that he's reported pain. We know that he's reported anxiety, and this allows the care team to kind of reach out and have that information well in hand when they reach out to him. Well, thanks so much for your attention. I look forward to speaking with you and answering any of your questions.